mental illness. It's something that's so talked about yet so unknown. Mental illness can affect people in many different ways. It can affect their physical health, their relationships with their family, including spouses, children, etc. It can really affect everything in your life, and that's why it's a very important topic to be aware about. Did you know that over 50% of people will be diagnosed with at least one mental illness in their lifetime? And 1 out of 5 people will experience it in just one given year. 1 out of 5 children have had seriously debilitating mental illness in their childhood, current or not. So, you might be wondering, what is mental illness? According to the CDC, mental illness are conditions that affect a person's thinking, feeling, mood, and or behavior. So there are a multitude of mental illnesses, but I'm just going to hit kind of the top 5 most common ones. So our first one is depression. It's this overwhelming sense of sadness, loss of interest, and just kind of a low feeling. This is the one that affects your physical health a lot. Our next one is anxiety. It's where you feel worried and uneasy a lot, and it's an overwhelming sense of that. And then there is obsessive compulsive disorder. It's where you pay close attention to random details, the fear of germs. People often misuse this phrase and want to self-diagnose themselves with this, but it's actually a very debilitating mental disorder. And then we have bipolar disorder, and it's mood swings, so you have very depressive lows and crazy manic highs. And then there's PTSD. This stands for post-traumatic stress disorder. A lot of the times it's when you experience something traumatic in your childhood or just in earlier years of your life, and some things will just re-bring that feeling up. So now that we know some of the top 5, we're going to move on to the causes of mental disorders. So we have life experiences that can cause this, which would be trauma, abuse, sexual assault, really just anything traumatic that could have happened in your lifetime. And then we have biological, which is when genetics come into play and chemical imbalances. So in my family personally, we have mental disorder that runs in the line. So that's an example of that. Chemical imbalances really it's just kind of how our body works. So really anyone can have mental disorders. And another cause is your environment. So, unhealthy thoughts, if you're around drugs and alcohol a lot, that can really cause mental disorders. So, now that I have scared you with all the different mental illnesses and the causes, let's talk about the treatments. So, there are lots of medication for this. There are antidepressants, which are for depression, of course, but can also be used for bipolar disorder and a few other ones that I may not have talked about. There's anti-anxiety, which is of course for anxiety, but also for OCD, because OCD can sometimes lead to anxiety. And then there's mood stabilizing. This one would really be used for the bipolar disorder, since you do have those depressive lows and the manic highs. And then a very good resource also is therapy. There are psychologists, therapists, but you can also talk to just a respected adult in your school, at your job site, anything. Okay, so we have now learned what mental illness is, the causes, which can be just life experiences, everything else, and the treatments, which are medicines, therapies, etc. So now with all this new information, I want you to be able to help someone that is in need. I want you to advocate for mental health awareness. There are plenty of programs in schools, jobs, and just really in your community for you to do. Thank you.